My first question, Dr. McGovern, I really want to get an idea. This is the one thing that remains unanswered for me is when it comes to Apollo MD, and its lane emergency physicians, what would make this contract work where EEP stop working?
So if I reframe that, why Apollo MD and not EEP?
Yes.
Is that okay? Just kind of starting where we are, right? Very complex emergency department has grown tremendously in the last few years. Have a large amount of respect for the physicians in EEP and the care they deliver to patients every single day. But we need to be able to maximize our emergency department in a way that we haven't had to in the past. It's too small, right? Our volumes are up. We are dealing with boarding. And so being able to come in and look at the emergency department, use process improvement tools and resources. Apollo has national resources that EEP just doesn't have access to. Process engineers, lean facilitators, leadership development mentoring. Just there's a complete package that Apollo MD can work as a local group and have national support that EEP just can't provide.
So there was no way that EEP could have matched their proposal because there were just elements you wanted. That
Look, when we looked in, I mean, I walked into the RFP process really not knowing what to expect and looking at what's best for Lane County and our emergency department. EEP just really brought a lot more than a local group could provide. And I can let and Dr. Patel can kind of speak to everything they bring, but that really made the difference.
as far as Dr. Patel, what would Apollo MD do differently than EEP?
Yeah. It's a great question. I'll start with just in general laying the groundwork of who we are, because I think there's been some mischaracterization. And we're unique in many ways. One, we are a 43-year-old organization. So we started in nonprofit healthcare in 1983. In many ways, we have the same principles and ethos that we did 43 years ago when we started in the basement of Cobb Hospital. So over the years, we have grown as a private practice. We are completely clinician owned. There's no outside private equity. There's no venture. I know there's been a lot of discussion about that. But the reality is we have been serving communities like Springfield, Eugene, Florence for more than 4 decades. Like myself, our entire clinical leadership team is active clinically. We are working real shifts in emergency departments, in hospitals, shoulder to shoulder. So we're operators, right? And we experience the challenges that Dr. McGovern just laid out, along with our teams. So things like boarding, behavioral health holds, resource challenges, variability in specialty services and availability of that, volatility of patient acuity. And of course, over the last few years since COVID, this dramatic rise in acuity and how sick people are when they present to the emergency department. I think the difference between, or one of the differences between a group like ours and a group like EEP, who is from everyone that we've spoken to, a high quality group of physicians. We have deep respect for a 35-year legacy, is scale. I think we early in our careers, in our genesis, decided to invest in these resources. We have project managers that help follow up on emergency department redesign. We have an entire patient experience team. We have a throughput team that maps out the patient journey and figures out how do we make each point of interaction for a patient smoother, without friction, so they can navigate this process throughout the hospital. And these are resources that, as a small group, it's really hard to kind of cultivate and afford. We do it by spreading those costs across our 130 some odd practices. And that's the way we've built an organization that can see over 4 million patients a year. I've spent, as I mentioned at the start, I've spent 98% of my professional career at ApolloMD, 18 years and counting. I'm proud of the work we do, and all the credit goes to our teams on the ground. We serve large level one trauma centers, academic centers, all the way down to critical access locations. And we really looked at this proposal as the need for a broad community solution, right? You have two smaller hospitals, critical access level, and then all the way up to, a very busy, growing trauma center. And so it needed, a group, in our estimation, that had multi-hospital capability.
Let me move to Dr.
Yeah.
McGovern really quickly. I didn't kind of frame my last question to you correctly. I want to ask if EEP was given the opportunity to meet or match or match Apollo MD's
Sure.
proposal, and if there was any financial element to this.
Sure. And I apologize. I think in my last answer, I said EEP when I meant to say Apollo. So the RFP process, you basically go through and people present what they have, right? They give a presentation, what they bring to the table. There's some question and answer and some further elucidation, if you will, or ability to understand. And then we award the RFP. We didn't go back and say to EEP, oh, Apollo is going to get this. We'll give you a second chance to see if you can match what Apollo would have done. Just like we wouldn't have, if EEP had gotten it, we would have not have gone back to Apollo and said, oh, you get another opportunity to win this. So we went through a fair process, open, transparent with the participants. They all got the same information, and we made the judgment of who we really felt was the best partner to go forward in our partnership in improving the emergency care in Wayne County. The second part of the question about the finances, we certainly have had some financial challenges. I think the number that I've used is our net cash flow is a negative $800 million over the last 4 fiscal years. That has led to layoffs, some restructuring, a number of leadership changes. It did not play a role in this decision. This was not a financial decision. One of the things I really love about PeaceHealth is they will invest money in patient care, even when you're having losses like we've had. Mm-hmm. But I want to be very clear with people, this was not a financial decision.
And I have to address this. Recently, medical staff, nurses, they voted majority no confidence in you and Dr. Rusher. Imagine I'm not Gold Meadows and I'm one of those medical staff or one of those nurses. What do you say to me, and how is this fence mended?
Yeah, it's hard. I mean, it's hard for me personally. I've been here for 7 years. I've went through COVID. I've worked side by side with a lot of these nurses or physicians in planning and administrative type things. I haven't delivered clinical care here. So I think what I would say is I'm sorry. I know this is an incredibly difficult decision. It's clearly disruptive. I still believe it is the right decision that we made. We could have done a better job of explaining it, of having some conversations ahead of time. And we're already starting to have conversations with the medical staff around how would we maybe do this differently next time. The decision might be the same, but how do we gather input? How do we allow people to express concerns and help maybe work on mitigating those concerns earlier in the process than where we are right now. So I definitely feel it. It's hard to have people tell me I'm not living the mission when I think I've done that for 7 years since I've been here. And we'll work to see how we make difficult decisions differently or involve people differently in the conversation going forward.
And to clarify, this isn't about the physicians themselves and the work they did, but it's about the scale of EEP and their ability to go where you want to see the hospital go.
Yeah, there's two parts of care. There is the clinical part that the physicians in the room with you making a diagnosis, taking care of you. The EEP physicians do a great job there. It is the process improvement, the flows, the managing in the department. We would love for the individual physicians to join Apollo, to continue to practice our emergency departments. That's always been the goal. They've chosen differently, and I have to respect that. But no, this is not about the individual physicians.
So, Dr. Patel, let me ask you
Yeah.
In that same vein, with these 41 doctors or physicians and physicians assistants saying, they're pledging not to come through Apollo MD back to the hospital, how will you manage to staff that many physicians and PAs?
Yeah. Um, One, I want to reiterate that, look, our doors are open. The first thing we did when we got on the ground, after the announcement was made, was we made it a point to reach out and meet with the leadership of Eugene Emergency Physicians. We had a long, productive conversation, and our goal continues to be to keep local physicians local. So those clinicians that do want to stay, we absolutely have made overtures. We will continue to reach out. But at the end of the day, when we make a commitment to a health system partner, we are going to fulfill that commitment. And so we have currently 59 clinicians, physicians and advanced practice clinicians going through the credentialing process. Um, we have already started recruiting nationally. And frankly, we've already hired a few people that will be relocating to the area because Eugene is a vibrant community. I think I want to be very clear. I think we believe that, the community deserves the highest level of care possible. And we came into this fully intending to build on the legacy of the current clinical team, to build on their foundation, and really hoping to build around them. I'm maybe optimistic and naive, but continue to reach out to them, hope that they will stay, but absolutely we'll be ready, June 1st and July 1st to serve the community. Our model is simple. We help build local teams to deliver care and support them with national level resources. We use the best practices and technologies from all over the country to do that, and that's our goal here.
And how will Lane Emergency Physicians operate? How will that look?
Yeah, Lane Emergency Physicians, it was formed specifically to anchor this practice locally. So it is a private group. ApolloMD is really the management services organization that powers them, right? So we will provide all of the background resources that they need, including, some of the assessments that we've talked about to really look at the redesign. PeaceHealth is making a huge investment in redesigning the Riverbend Emergency Department. We are going to be working closely with their teams to help guide that and make sure that we can maximize the efficiency of the space in the service of patients.
Dr. McGovern, I know you're more aware than anyone of the issue of long wait times in the ER. And then we've had some physicians speak with us and say this change will, at least at the onset, impact the quality of care. What do you say to that concern?
Yeah, that's where our focus goes now is the transition to make sure that working with Apollo, their onboarding materials, their training as they bring in new physicians helps us mitigate any possible gap. So it is more challenging for a physician to come in and not know the consultants, not know some of the things that they need to, but Apollo does this for a living. They transition emergency departments. They've got a strong transition plan. They'll be on site next week, actually, to talk to physicians about what our practice flows are. And so I'm confident that we'll work together to mitigate those concerns. The practice of medicine is the same when you're in the room with the patient. The questions you ask, your physical diagnosis, the exam, those things happen the same. It's some of the process in the background, but I have a lot of confidence in Apollo and the work that we're going to do in the next 4 or 5 months to get physicians ready to work here.
And Dr. Patel, just
Yeah.
confirming, you are currently in 19 states?
Oregon will be our 19th state. Yeah. And to Jim's point, look, we have done transitions, large transitions. I think 2 years ago, we transitioned in the Memphis market to the Methodist Le Bonheur system, large 5-campus nonprofit system, 225,000 visits. In that instance, we kept 85% of the clinicians that were already there. And myself, my senior leadership colleagues rolled up our sleeves and we went to work. We are not we're not coaches on the sidelines calling plays. We are putting on the scrubs, lace up our sneakers, we go to work. And we experience the opportunity and the challenge in real time with our clinical teams. And that's what we hope to do here. So we are excited. We are cautiously optimistic about hoping to keep some of the clinicians that are there that want to stay. But we are also preparing to be ready June 1 and July 1 to deliver care to all the residents of Lane County.
And the bulk of your practice has been in North Carolina. So you understand the issue locals are saying, like, one
Yeah.
place is not the same as another. There's
Yeah.
a language they speak in that ER. How will you get up to speed?
Yeah, we are going to spend the next several months doing exactly that. As Dr. McGovern said, making sure that we understand the care pathways that are used locally, the preferences of some of the specialists, the community, but it is surprising how much care is more alike than dissimilar, and I think many of the challenges that we've heard about in our initial conversations are things that we experience and see in other parts of the country, whether it's boarding and overcrowding, whether it is a primary care gap. And I know some of these things have gone on in the community locally, and our goal is to kind of work to make sure that we can overcome those challenges as well.
And Dr. McGovern, one more question for you. Is there anything you'd like to say to the community that is clearly concerned right now?
Yeah, for me, I think it's our commitment to access to care, access to good quality care, and really care across the continuum. So I am committed, my team is committed, we are committed to good quality care and access to it. So wait times are too long or EMS wall times are too long. And I really firmly believe that Apollo MD is the best partner to improve those over the long term. So we will be here. There will be emergency medicine boarded physicians taking care of people. So there's been a lot of talk about access isn't going to be there. We're not going to have good care. We will be staffed and we will be delivering good care on June 1st in Cottage Grove and Florence and on July 1st in Riverbend.
All right. Any last thoughts, Dr. Patel?
No, I would just echo, I think, Jim's sentiment there that we are, at the end of the day, this isn't really about organizations. It's about ensuring that every patient in Lane County has access to safe, reliable emergency care and when they need it most. And we are excited to rise to that challenge.
And one more question. How
Yeah,
many emergency rooms are you staffing right now?
that's a good question. We have just over 100 emergency medicine practices across the country. Um, yeah.
All right. Thank you both so much for
Yeah.
speaking with
Yeah.
me today. I appreciate your time so much. So I have a couple of questions just from what I've learned so far from PeaceHealth and ApolloMD and wanting to get EEP's perspective on everything. First things first, the most recent thing is this vote of no confidence. What was your response to that?
It's incredible to see all of the colleagues that we work with on a daily basis support us in that way. I work nights particularly with my group, and so I have somewhat more limited interactions with all of the physician colleagues. But to hear them, speak up in appreciation for the work that we do, our physician partnership as a whole throughout the colleague is very strong, and then to weigh in with their names. This is through the med staff meeting. That's public who's voting on this, and to support us so overwhelmingly. It's just an incredible show of support.
Peace Health and ApolloMD say this wasn't a financial move to switch from Eugene Emergency Physicians to ApolloMD, but that it was EEP's inability to scale its services to where Peace Health wants to go. I was told that was the deciding factor when choosing the RFP. What are your thoughts on that statement from Peace Health and ApolloMD about EEP's ability to scale?
Well, first off, I think that the hospital leadership has provided somewhat inconsistent statements about why they were offering this RFP. When it was initially announced, they did state that they felt that they had financial responsibility to the hospital system because it's been under a lot of financial stress, and that they wanted to make sure that they had the most financially appropriate contract for the site. After the RFP announcements were released, they later said that it was not a financial decision. So there's definitely been some incongruity there. EEP has worked with the hospital in many ways to improve the services that we offer to the hospital, to try to innovate within our own emergency department and through our group on new programs and new patient flow initiatives, whether we keep patients moving through what we describe as our vertical track or rapid medical evaluation or fast track programs. Eugene Emergency Physician welcomes any partnership with the hospital, or if the hospital has specific recommendations about ways in which they want us to be better able to meet their demands or growth. We would welcome bringing in either outside consultants if they feel that's appropriate. We're just continuing to work with them on some of these processes that Eugene Emergency Physicians has already started.
Some of the things that ApolloMD said it had were project managers to follow up on emergency department redesign and a patient experience team to help patients through the ER process and making that smooth. And also said that things like this were hard for a smaller group to afford. Would affordability be an issue for EEP if the hospital needed different services like that?
Certainly when we're looking at a corporate medical group, which has nationwide coverage and is currently and has very recently been backed by private equity funding, a local emergency physician group is not able to match the resources that ApolloMD has to bring. That being said, a lot of the things that PeaceHealth is talking about, or ApolloMD is talking about, what you referenced, we have been working with the hospital to do. PeaceHealth has recently discussed and has been putting out more information about the emergency department redesign at Riverbend. And over the last at least year, our emergency physicians group has reviewed plans. We've held internal meetings to review and update those documents. We've worked with the hospital to discuss, how patients will move through those plans. And ApolloMD, in a lot of ways, is going to be stepping in to, if this emergency department redesign follows through as planned, they'll be stepping in to benefit from that to improve their patient flow. And that's, potentially years of work that we've been doing with the hospital to try to improve the emergency department.
So let me clarify, you're saying the improvements that are about to be made in the emergency department will automatically improve patient flow, where even if the 41 physicians and physician assistants were still there, they would have had the same improvements.
I think that we would have been better able to take advantage of these improvements because we've been involved with the process design for them, taking into account, the mix of PAs and physicians that we have in our group. We definitely try to keep a physician-forward patient care model, and that's not typical of a lot of corporate medical groups when they come in. Obviously, working with mid-level providers or PA or nurse practitioners who can provide excellent care for a wide range of patients. If they have more of that provider, it might not match the department design that we've been working on with the hospital. But if Eugene Emergency Physicians was continuing to work there after the emergency department redesign, or if ApolloMD is working there, either of those groups would benefit and be able to see some metric improvements.
Eugene Emergency Physicians, all 41 of those medical staff signed pledges not to work with ApolloMD. Why did that happen, and what could that look like? How many actually signed that saying, at least within the first 90 days?
So we had a lot of group meetings about that when the contract was first announced to ApolloMD. Recognizing that we staff PeaceHealth's emergency department. The only I would say, capital that we own is a small office space and one office manager. And beyond that, our value is as a unified group of providers. If our providers are replaced, then we cease to exist, and we have no leverage to bring to the table. So we felt that signing a pact, which is it's non-binding, everybody volunteered to sign this, to say that that we would not transition from our long-held democratic group to becoming independent contractors for a corporate medical group, was the only leverage that we had in pushing back against this incursion of corporate medicine into Oregon's local medical providers.
Right now, you saying that you would basically no longer exist, and be all would become independent contractors. What is the feeling among these providers? What um, I know you all will be in Salem on Thursday. Um, I'm just curious how everyone's feeling about what's happening, about the pledge, about the potential that you could dismantle.
I think we've definitely gone through a lot of stages of grief when this, was first announced, because we've worked so hard for so long for our community and our patients, and we love working with the nursing and additional support staff at the hospital and our colleagues there. After kind of recovering from the initial shock, there's just been an incredible resolve within the group to remain unified, to work together to push against this, to demonstrate to the community how much support we have and how appreciated we are. And as an independent local group, what we can bring to the table that we don't believe that a corporate medical group could replace, especially as they currently look to hire, traveler physicians from across the country for temporary 6-month positions while they further sort out their staffing model at the hospital.
In addressing the community and the support and people pretty concerned about what's transpiring, what do you say to those community members who are concerned?
I think that we have been there for them for 35 years to provide the best medical care that we can. People come to us in tremendous states of vulnerability, and we've been there for them. And our group right now is having certainly a vulnerable moment up against, like I said, a corporate medical group with former private equity backing of hundreds of millions of dollars. It's very, very difficult to push back against those sort of business interests. But we need the community support to help local providers stay local. And as was recently demonstrated with the Optum takeover of OMG, community physicians are here for the community, and corporate interests are not necessarily here for the community. ApolloMD is not coming to Eugene and Springfield area because they think that it's necessarily best for us, regardless of what their statements might be. But they see this as a growth and business perspective. If people can reach out to local or state representatives, or if they could take a look at PeaceHealth's board or foundation, if they have connections to these people, certainly reach out, make your voices heard, because we need everybody's support to make this successful.
And my last question for you, Dr. Brown. Senator Manning invited you all to come and speak before a Senate committee. What do you all hope is accomplished out of that?
There's definitely twofold, goals for this. First off, Eugene Emergency Physician wants to be here. We want to continue practicing in our community. We've had amazing support and outreach from the senators and House representatives, despite their busy short session that they're engaged in right now. We know that they are going to bat for us, pushing back against PeaceHealth's local as well as regional executives to ask them to reconsider, come to the table to renegotiate, or talk to us about how Eugene Emergency Physicians can become better and different in whatever ways the hospital feel would better meet their goals. And I think the second big goal is that we want to, just like the Oregon State Legislature, we want to make sure that corporate medicine, private equity does not continue to come into Oregon's local medical providers and cause some of the disruptions that it has already started to cause. We strongly support the previously passed Senate Bill 951, which tried to specifically address this concern. And ApolloMD taking over Eugene Emergency Physicians contract is a direct and very timely challenge. This bill was only passed into legislation during the last session less than a year ago.
And I'm going to touch on that just briefly. That Senate Bill 951, I'm pretty sure that ApolloMD created Lane Emergency Physicians to comply with that. Would that do you think that would suffice in making them viable here in Oregon?
I've reviewed the legislature bill as much as I can. I have no background in law, and I think that they have, as any large corporate medical group would, they have a lot of attorneys that have probably looked at or reviewed this. They may be complying with the letter of the law, and I certainly don't think that they're complying with the spirit of the law. And that's a point that our senators and representatives are certainly looking into aggressively, because when they passed a bill into law, they wanted to have a real effect, and to have a company immediately come in and try to circumvent that, certainly makes them upset. They want to defend the work that they've done, and they did it for a reason in the first place, because they don't see a role of corporations or private equity-backed companies coming in to practice medicine in Oregon. Like I said, they don't come here because they think that it's going to specifically benefit us. They come here because they think that it's a business opportunity.
Awesome. Anything else that you'd like to share with our viewers?
I just appreciate yourself, getting our message out there to all the viewers for listening to this. Everybody's had a chance to hear PeaceHealth executives and ApolloMD make their statements. And I think that Eugene Emergency Physicians, like I said, we want to be here for the community. We want to remain in the community. We think that we have unique benefits as very long-standing local providers.
And if you don't mind, one last question. Could you elaborate a little bit on those unique benefits?
So over the years, Eugene Emergency Physicians, because we have, and the number changes, but we've had 30 to 40 partners on top of our PA staff. We all live here locally, some within only minutes of the hospital, have responded to mass casualty events a number of times, with the Thurston High School shooting, Umpqua Community College, the Wow Hall shooting, and through internal notification groups that we have been on alert, just as recently as there was an incident at Ninkasi Brewing, and we didn't know if there'd be a large number of patients coming from those. So we can respond within minutes with a large force of physicians. If a corporate medical group had temp agencies or locums doctors flying in from out of the area, those resources simply aren't available. Our commitment to the community extends to working as medical directors for Life Flight, Eugene Springfield as medical directors, and multiple other EMS companies. Members in our group volunteer on local boards, including at Whitebird, Volunteers in Medicine. And as people finish their career in emergency medicine, we have a lot of people that retire from our group. They continue to be active in the community, whether that's staffing urgent care or working on one of our partners is very closely aligned with the World Track and Field events, again, providing medical directorship. So, keeping the talent and the staff and the providers local has benefits that extend far beyond the emergency department itself.
Awesome. Well, thank you again, Dr. Brown, for making time for this today. I appreciate your time.
Thank you so much. Appreciate you.
My pleasure.
Bye bye.
Bye.